All right, guys. I'm going to start with your guys' review. So can anybody tell me what's an EHR and what's HIPAA?
Electronic health record.
Perfect. And what's found on the electronic health record?
Patient's records, and which would include like assessment, diagnosis, intervention planning, everything pertaining to a patient.
Yep. Absolutely. And HIPAA.
Health Insurance Affordability and Accountability Act.
What does HIPAA entail?
Like basically patient privacy, their right to privacy, that you can't share their information.
What does it entail for computers?
Locking your computers when you walk away. You're responsible for anything being shown if you leave your computer open or it's still private. You still can't share anything.
Correct. And what kind of communication tool do you want to use when communicating with a healthcare provider? If you're contacting a physician, what is the name of this report sheet that you want to use?
SBAR?
SBAR, yep. Perfect. We'll move on to hygiene and safety measures. We just went over a lot of them. So this is a select all that applies question. What are you going to want to do for hygiene for older adults and in regards to safety?
Avoid fall risks, such as avoid any obstacles in their home. Would be extension cords, rugs. Be mindful of any clutter.
Perfect. Yep. Cindy said this. If a patient has a walker and doesn't have this, what are you going to get them for the shower?
Shower seat?
Yep. Shower chair. So non-skid mats, shower seat. Also, as you age, parts of the body don't work as well as when you're younger. So just like for babies, before you put them in the bathtub, what are you going to want to check with the water?
Temperature.
And if they can't reach to wash their behind, what would you get them?
One of those handle brushes, or what are they called? Is that right? Okay.
And big thing is you don't want to use a lot of soap because that poses a risk for falling. It makes the floor slippery. Shift report criteria. You and another nurse are going in a room and you're going to get bedside shift report. What are you going to include in this bedside shift report?
Patient's name, date of birth, and room number.
Mm-hmm.
And their diagnosis, their attending physician, and their on-call physician.
Yep.
Any abnormal occurrences during your shift, reports on patients who have been transferred or discharged, any current orders, any unfilled orders.
Yep. And so like pain medications, if the patient has any dressings, you're going to want to bring that up. Do you want to sit there and tell them what their favorite color is? You want to sit there and be like, oh, this patient's favorite color is blue? No. You don't want to talk about that. You don't want to talk about their interests. What is going on with the patient, why they're here? Keep it simple.
What about like if they've had a bowel movement or how much they've output during the day, or would that just be something that's in their chart that you charted during the day and the nurse can look at that later?
It would be something in the chart, but I would also discuss it like if they haven't had a bowel movement, for 3-4 days, I would definitely bring it up, because then maybe we need to get medications on board.
Basically, anything
Also-
that happened during that shift, right, for that specific nurse that pertains to medical care? Or
Yep, you don't want, you just don't want to go over like hobbies and personal interests. You want to go over strictly medical needs and what's going on with the patient.
Okay.
So again, name, room number, diagnoses, labs, dressing, and pain. If you've medicated them with pain meds, you're going to want to say what their pain level was, when you medicated them, and when the next available dose is. Adolescence and safety. Pretty much with adolescents, a huge thing is driving. They get in a lot of motor vehicle accidents. So pertaining to history, to safety with driving and adolescents, what are you going to teach them?
Seatbelt. Drive.
Seatbelt?
Yep, seatbelt, driving limit, speed limits.
Yep.
Not under.
Abstaining from drinking and driving.
No drinking and driving, yep.
Texting and driving.
And driving. And also you're going to want to limit the number of people in the car, because those are distractions too.
Is that a law here in Arizona? I know that it was in Illinois, and I just moved here about a year ago. So my kids actually, they needed to have a certain amount of, they couldn't have a certain amount of kids in the car.
It actually just passed this year, and
okay.
you are not allowed to use your cell phone anymore while driving. But yeah, I used to have a bad habit of using it while driving, I'll be honest.
No, the number of passengers.
Oh, number of passengers?
No, there's no law for it. California, there is. You have like a 2-year, I think 2-year provisionary
Yeah.
license where you
That's
can't have
not-
anybody where you can have anybody in the car under a certain age. I think it was 21. But here, there's no law against it.
Fall risk, let's see here, we're at fall risk factors of the in-home with older adults. We kind of touched base on this. What's the acronym for this, guys? Starts with a D. It's DAME. DAME. Drugs and alcohol is the D. A is age-related physiologic status. So that's declining. M, medical problems. And E, environmental. So those are what you want to look out for. With that being said, drugs, what kind of medications can pose a fall risk to elderly?
Any
Those-
benzodiazepines?
Benzos can. Your diuretics are a huge one for the elderly population, because it's going to diurese them. It's going to take that fluid and it has to come out somewhere. So they're going to be making frequent trips to the bathroom, and they're going to be like, I gotta go. And that's when they fall. So,
Also opiates too, right?
yep, opiates, diuretics, your blood pressure medications, and your benzos. Those are huge. Age-related physiologic status, that's just age-relating issues. Your bones, they become more porous, you get osteoporosis, you get your muscle mass weakens, it lessens. For medical problems, can be such as like a diabetic, they lose sensation. You get neuropathy. And you're going to want to install handrails in the bathroom. That's very important to know. Okay, injuries in the workplace. This is the select all that apply. So, what are some workplaces that are more dangerous than others?
Factories,
Factories, because of why?
heavy machinery,
Heavy machinery.
Police department, fire department.
Heavy lifting,
Repeated movements.
also nursing. Wait, what was that last one, Bailey?
Repeated movements.
Anything with repeated movements, yes. So nursing. So heavy lifting, dangerous machinery, factories because of exposure to noise and chemicals, and then also with healthcare workers. What are healthcare workers, especially RNs and LPNs, very prone to happening? When you're pulling up a medication,
Strain.
Needle sticks.
needle sticks. There you go. Those are the main ones right there. Those 4.
We had an RT do that the other day when he was doing a blood gas and actually like went into the patient and into his finger right after.
Yeah, I'll tell you, a blunt tip needle does not feel real good in the finger. Restraint criteria. This is also select all that apply. Oh my goodness, is this go out of order? Injuries in the workplace, verbal. Oh, I missed that one, that's why. Hello, Jackie. Verbal orders, select all that apply. What are you going to do when a doctor gives you verbal orders?
Requested in writing.
Repeat it back to them.
Repeat it back. Yep. So it's an emergency situation.
Okay.
Can't have them write it down. You're gonna RBAV is what I call it. Read back and verify. What else are you gonna document on a verbal order?
Who requested it?
Date of birth, name.
And then it was a verbal order.
Physician name, that it was a verbal order.
Now, don't you have to have it in writing within 1 hour, or is that something else I'm thinking of?
Yeah, the physician needs to sign and review it. That's for the restraints.
Oh, okay.
But the physician should need to review and sign it after the order. You need to record it in the medical record. And there's a huge aspect you guys missed. Anytime something is given to you, you're going to record the date and the
Time.
Right, there you go. Now we'll move on to the restraint criteria. What components are needed to use restraints?
It just document all the other things that you've tried before the.
Yep. So it needs to be justifiable. You need a blank order,
Doctor's order.
doctor's order. You are going to try least restrictive measures first, like Dana said. Where are you going to tie the restraints to?
The bed frame.
Bed frame. Non-moving parts, guys. You put that on a handrail. I've seen it happen. CNA goes in, rips that handrail, and it drops down. You just caused a friction sore. So always non-moving part of the bed. You need to remove the restraints every 2 hours to allow them to have range of motion. How many fingers do you want between the restraint and the limb?
2.
2?
Yeah.
Ideally 1 to 2. Yes, at least 1. I don't want to back up. Okay. What else here? They're threatening patient safety. That's usually why we use them. And why do we want 2 fingers between the restraint and the limb? What is this ensuring? That it's not cutting off their limb.
Circulation.
Perfect. All right, so it seems like you guys got the restraints down pretty good. Safety related to adolescents. We've talked about driving safety, but there's other things that adolescents are at risk for their age category. Does anybody know what these are?
Drugs, tobacco.
PDs.
STIs, drugs, tobacco, gangs, bullying.
Pregnancy.
Yep, safe sex. And sports injuries. So those 3. Sports injuries, bullying and gangs, and protected sex. And we have risk factors related to back injuries. What I can say about this is body mechanics. Just always have good body mechanics. What puts nurses at risk for back injuries, guys?
Unassisted lifts.
What was that, Krista?
Unassisted lifts.
Unassisted lifts. Yep, so lifting a patient.
Poor body mechanics.
Poor body mechanics.
Lifting with the back.
Lifting with the back. And also, nurses are on these constantly throughout their whole shift. You're on your feet a lot.
Standing for long periods.
So standing is a huge back issue. So standing on your feet, lifting patients, transferring patients, whether they be confused or alert and oriented, and have proper body mechanics. That's all. Protect your back. Don't be like me. Hygiene practices and infection control. So, how are you guys gonna handle soiled bedding? How are you guys gonna hold it?
Away
Away from your body.
For your body.
Away from the body.
And then don't you fold it into each other or into itself?
Fold it into itself. What are you gonna wear when you're touching?
Gloves.
Gloves. Perfect. You want to avoid contact. What does SOAP stand for?
Objective assessment and planning.
Okay, perfect. Yep. So then just kind of know what a subjective statement is, an objective statement, what an assessment is, and then what a plan is. You guys want me to go over that, or do you guys think you got that?
I think I'm good on that one.
Yeah, I feel like we did a lot of that the last time.
Perfect. Okay, so I will move on to Erickson's developmental levels. Know it frontward and backwards. Okay, what is the first step on Erickson's?
Trust versus mistrust.
Perfect. Number 2.
Autonomy versus shame and doubt.
Perfect. Number 3.
Initiative versus guilt.
Number 4.
What was that last one?
Initiative versus guilt.
What?
Initiative versus guilt.
Thank you.
You're welcome. Number 4.
Industry versus inferiority.
Okay, and what are school-aged children doing during this stage? What are they concerned with? Especially in
Their
school.
recognition.
Self-esteem.
and faith.
Succeeding and accomplishing. Number 5, identity versus role confusion. Here, what are they trying to do? What is identity versus role confusion?
They're trying to figure out their path and what they're going to do with their future.
Perfect, which oftentimes leads to rebelling. Number 6, what is it, guys?
Identity versus isolation.
Intimacy versus.
Yeah, intimacy.
Number 7,
Generativity versus stagnation.
perfect. And number 8,
Integrity versus despair.
perfect. Changing an occupied bed. How do you guys change a bed when somebody's in it? You push on the patient? You pull on the patient? Do you use the
Roll them.
You roll them towards you so you can, like, I don't know. How I did it was like I always took off the corners of each side before I rolled them at all. And I would roll them towards me if I was alone, and then bring all of the linen and stuff it under their back. That was like if they were super dependent. If they were independent and can roll, I would let them roll themselves and stuff the linen under them.
Perfect. Don't push or pull on the patient, hands off. That's the way I can explain it to you guys. Hands off, use the sheet. Use leverage. Don't be pulling and ripping up yourself. Incident reports. Let's see. Okay. Why do we use incident reports?
Or an incident that happened.
For quality assurance
Yep,
improvement,
it's
excuse me. Quality improvement.
Yep, internal review and improvements. Is it a part of your the patient's medical record or no?
Yes.
No.
No. Perfect. And what is it going to entail?
Date,
Do you have a
time,
patient?
description?
Perfect. A complete description of what happened. So you're going to want to go over the circumstances that were happening prior, during, and after the event. So if you have a patient that gets up and falls, what were they trying to do prior to the event? Prior to them falling, were they trying to get to the bathroom? During would be the actual fall itself. You know, I slipped on urine, I didn't get to the bathroom, they fell. Afterwards, what did you as a nurse do? Did you need to administer first aid? Obviously, take vitals when a patient falls. Did you call a rapid response because they're on blood thinners? What did you do? So you're going to document everything. ADHD. What is ADHD? What are the 3 components that classifies ADHD?
Attention deficit hyperactive disorder.
Right? So hyperactivity. If you have an attention deficit, it's from inattention. And these patients have a tendency to be impulsive. So inattention, impulsiveness, and hyperactivity. Okay, and here we go again with HIPAA and passwords. You have a nurse who can't get into their computer system. Are you going to give them your passcode?
No.
No, you never share passcode. What's the appropriate action for you to do if that nurse can't get in? What are you going to tell that nurse to do?
All IT.
Oh, IT, there you go. IT's our friend. All right, anti-embolism stockings. These are your TED hose. What do you want to watch for? Or you want to make sure it's not cutting off what?
Circulation.
Circulation, perfect. Are you going to leave them on when you take your patient for a bath?
No.
No.
No. Right, it's a slip hazard. Take them off. What are signs and symptoms of these TED hose cutting off circulation? What's going to happen to the legs?
Discoloration.
Discoloration, and
Temperature.
right, it's going to be digging into the skin, so it's going to leave what? A blank of the skin. Indentation. This is huge to know. These 2 next ones are huge components. And it is brought up multiple times throughout this study guide, but on my end, I put it just in one. So, what are some factors related to growth and development? Family history, so your
Genes.
Genetics.
genetics, there you go. Your, what else?
Environment.
Environment where you live. Yep, so genetics, environment,
Nutrition.
nutrition, absolutely. In infancy, what really comes about with nutrition?
Bonding to mom.
Allergies.
Allergies.
Allergies, yep. A lot of it. When infants go through a lot of food allergies. At what age do patients feel bladder fullness?
I'm sorry, what was that, Jackie?
At what age do patients feel bladder fullness?
Round 2.
Perfect. Same thing with bladder control. And in what trimester are malformations likely to occur?
First.
Perfect. And
What did you just ask, Jackie? I couldn't hear you.
when are malformations likely to occur for fetal development?
Oh, we're on the next one. Okay.
And yeah, it kind of bounces back and forth. I kind of put them all together. Adolescents are concerned with what? I went over this already, but let's see if you guys got some of it.
Their identity.
Identity. So peer relationships, social, sports, and body normality. Factors related to fetal development. That was that first trimester malformation. What is also an issue with fetal development?
Mom's nutrition.
Mom's nutrition. Happens a lot here. If you sit at the Taco Bell here in Havasu, I'm sure you see a lot of them outside.
Homelessness?
Drugs and homelessness. Inadequate prenatal care. And also age. What puts a mom at risk? What age ranges put a mom at risk? From
Over 40?
anybody greater than 35 and your teenagers less than 15. So less than 15, greater than 35. Those are your high risk pregnancies. If you're greater than 35, it's called AMA, advanced maternal age. Common health problems of infants.
Jaundice?
Can be.
SIDS, colic.
SIDS. Whoever said SIDS. Got it. So how are you going to prevent SIDS?
The
Lay them on their
sleeping,
back.
the sleeping of the position of them while they're sleeping on their back.
Perfect. And if a kid was once potty trained and then magically they pee the bed, what is this called?
Your
What are they
Regression.
Regression.
Regression. There you go.
dang it.
So those are the two common health problems of infants. Infant safety. Worry about car seats, guys. That's the main thing with infants. Sundowners. What is going on with people that are sundowning? It's exactly how it sounds.
Sun's going down and they have behavioral changes.
They have behavioral changes. So what happens with their behavior? They become what at night?
Aggressive?
Combative.
Yeah.
Agitated
Everything confused.
and pleasant. They can be pleasantly confused, but usually
And don't they get depressed?
they can. So they're wakeful and agitated is a huge one.
Wakeful, you said?
Wakeful. Yep. They wake up and they want a hamburger at midnight. They're going to go into that kitchen, even though it's the bathroom, they're going to make you a hamburger. All right. Physiologic changes in the middle adult. What happens with the middle adult? What changes are they going through physiologically?
Bone loss.
Menopause for women.
Can be, absolutely. Who said bone loss?
Me.
So that's increased loss of calcium. Yep. They're becoming more tired. What is this? If you become more tired,
It's lethargic.
close. If
Fatigue.
you're fatigue, there you go. Cindy talked about this. As you age, you lose
Mobility.
oil.
Dry skin.
Right, you become dry, so you're not as oily. You have decreased oil levels. And then also your heart's not working as good, so you're going to have decreased what?
Circulation.
Decreased cardiac output or circulation. Safety and dementia patients. So What are you gonna do to promote safe dementia patients?
Are you gonna be good in there by yourself?
Make sure that they are not up and about unsupervised.
Not unsupervised. Yep. What are you gonna do with the bed?
Alarm.
Low position.
Lowest position, alarm. Yep. Perfect. What is the most common cause of dementia?
Medication.
Genetics.
Genetic.
No, so it's kind of a weird answer. Dementia and what's the other disease process?
Oh, Alzheimer's?
Alzheimer's. Yep. So, just a fun little fact that not a lot of nurses actually know. You cannot diagnose. Doctors will diagnose what they actually think it is, Alzheimer's disease, but a patient actually cannot physically be diagnosed with Alzheimer's until they're dead, because you have to see the gray matter in the brain. So it actually takes a coroner to determine if they have Alzheimer's, and not a lot of people actually know that. What is dementia?
Forgetfulness, confusion.
Does it affect you physically? Is it a cognitive?
It affects you cognitively.
Yes. So, and does it happen suddenly, or does it stay the same, or does it get worse as time goes on?
It gets worse as time goes on. It's a gradual onset.
Okay. So the word for that is gradual, progressive. There you go. Factors related to disease management in the older adult. So, what can affect the older adult with disease management?
Nutrition.
Can be. We see it right now, the Great Depression, economic difficulties, right? So economic difficulties can put them at risk for disease management. Access to medication and supplies. What's Lake Havasu Regional? If you are a patient there, you are hospitalized. Okay, so if you're hospitalized, that's also a risk factor for disease management. And also family coping mechanisms.
Jackie, if you're hospitalized, how is that a risk for disease management?
Because they might not be able to get the care, their other diseases outside. So, like,